All right, Gana, yeah, it's Thursday, so we set aside some time to talk with members of the medical community. Today we have Stephen Howell, an EMS Education Coordinator, New Hanover Regional Medical Center, talking today about hands-only CPR, which I guess I've heard of it, but when I heard of it that way, it's like, well, what about the breaths? And we were talking with Gana about that. And so there's actually situations now where you shouldn't use the breaths. Is that correct?
That's correct. With CPR, the important thing is to try to get CPR started as quickly as possible. So what we're trying to do is teach hands-only CPR to where for people who are worried about causing more harm than good or don't have the official training, they're at least initiating CPR to help out in the long run. For every minute that we don't do CPR, the chances of survival really decrease. So this is helping us bring that survival rate up here in Wilmington.
I know with people that are, maybe put in that situation unexpectedly, the fear is, I'm going to hurt this person even more, and they're worried to do something like that. But there are laws that protect people in that case, correct?
That's correct. We do have Good Samaritan laws, which will protect you from any legal obligation. As long as you're trying to help, you're covered with that.
As far as the hands-only CPR, I know we don't really have something in it, but as far as the process goes, is there a wrong way to do this? I know you want to concentrate in the center of the chest, but what do people need to know if they are put in this situation?
It's really simple. If you see somebody going to a cardiac arrest event, you want to call 911 first. And then you want to put your hands in the center of the chest, and you want to push hard and fast at a rate of at least 100 times a minute. It's really easy to think about Stayin Alive or row, row, row your boat will help them get the right rate.
Yeah, when I read the row, 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 I started thinking in my head, because 100 compressions in a minute, you're really doing some work.
You are. So it's really good if you can to grab other people to help you when you get tired. We'll make sure it's still effective.
And when are the instances that you would want to use breaths associated with CPR?
Well, if you have the training, of course, and anybody on like infants, unconscious patients that aren't breathing very well, cardiac arrest patients where you do have that training, the ability to do so, drug overdoses, anything like that. Those are the times where you don't want to do conventional CPR if you could.
And there are plenty of classes out there for people if they want and more information to learn how to do this. Can they do a class at the hospital? Is that offered through you?
They can. We actually have a website where they can go to, which I'm sure the hospital can give you that, and they can call, get information about that, send in an email, and we'll contact back with them and set things up to where the community can do it. Our goal is to have 200,000 people certified in hands-only CPR. Right now we've got about 15,000, starting about 2012, so we're still working towards that goal.
It's a great skill to learn, because you never know when you can be put in that position. I appreciate it, Steve. Thank you very much.
Thank you.
We'll be back after this.